Well, good evening, everyone, and thank you for joining us. It's great that you could make it out here for this very important topic. Opioid abuse, heroin addiction is unfortunately very much a suburban phenomenon of late. It is affecting all of our communities here on Long Island. I had the opportunity earlier today to moderate a forum out at Suffolk Community College where we had literally 30 people from different backgrounds, law enforcement, education, treatment. Some of the panelists we have here before us today, this evening, talking about this issue and how it's impacted our communities. And we heard person after person presenting story after story about how their lives have been affected, their family have been affected, and how they've lost loved ones. So, that myth that somehow drug addiction is an inner city problem, that it is a problem that affects socioeconomically challenged areas, is a myth. And the sooner we come to grips with that and we understand that, I think the smarter it's going to be and the better it's going to be for all of us as we try and put together legislation and policies that will address this issue. So yes, there is an educational component. Yes, there is a financial component and how we address treatment, but and yes, there is a component of law enforcement and a penal component with that respect. But I would ask that as we go through, let's keep in mind two distinct themes. One is the need to provide help comprehensively, the need to treat this as a healthcare issue, as we do with every other healthcare issue, and then to separate that from the need to make it a law enforcement issue, which is an issue that we have to address, but we cannot allow the law enforcement component here, I believe, to overcome the need for comprehensive treatment and to treat this as a healthcare issue for all of our communities. That being said, let me take the opportunity to please introduce our panelists. I'm going to ask each one of them to make a brief introductory statement, and then we'll get into some of the topics, some of the themes, and hopefully some of the questions that we have from our audience. Dr. Reynolds.
I'm Dr. Jeffrey Reynolds. I have the privilege of being the Executive Director of the Long Island Council on Alcoholism and Drug Dependence, which is a 58-year-old not-for-profit based right here in Mineola with offices in Suffolk County as well. To give you a sense as to what we've been addressing, 5 years ago, LICAD was serving just under 100 families per month. Last month, that number was 882. The vast majority of that, meaning in excess of 85% of that, is directly attributable to opiates, namely pain medications, OxyContin, Vicodin, and other opiates, and the move to heroin, which has been wholesale when we talk about young people. The average age of our client has dropped from 45 to about 25, and the level of use has skyrocketed from an average of 2 bags of heroin a day to 15 bags of heroin a day. So the numbers have skyrocketed, and the level of dependence that we're seeing in impacted folks has skyrocketed as well. I'm always a little disappointed when I look out and see a lot of empty chairs, because there is one health problem that rises above all others when we're talking about young people here in this region. And if I took a van with darkened windows and drove past the school very slowly and called out to a child this afternoon, Pam, I didn't, but if I did, this room would be filled with parents saying, what's going on in our schools? This can't be allowed to happen, and we need to find out what's going on. Well, you know what? We're losing 350 some odd young people per year here on Long Island to overdose. That means that some family tomorrow morning will start making funeral plans, most likely for an adolescent or for a young adult. That's got to stop. Completely preventable. Addiction is completely treatable. You can't cure it, but you can hold it in abeyance and treat it. and help folks find a path to recovery. So I look forward to a very robust discussion here tonight. I'm glad to see some familiar faces here. And certainly thank you to Senator Martins for hosting this. I will tell you that when I look statewide, the Long Island delegation and your senator here has done a phenomenal job at not only raising the issue in the community, but raising it in Albany and making sure that the voices of Long Island's families who are both at risk and suffering with addiction, their voices are heard loud and clear thanks to this man and the rest of his colleagues from the Long Island delegation.
Thank you.
So thank you.
My name is Maria Lisa Quadra, and I am the CEO of COPAY Incorporated, which stands for the Community Organization for Parents and Youth Incorporated. And we are located in Great Neck, New York. I'm also on the faculty at Adelphi University School of Social Work, where I teach classes, including classes in addictions and treatment for graduate students in social work, and we're a teaching site as well. I did bring some information, and you're welcome to take information with you. Included in it is an article on heroin and the dangers of heroin, and also the contamination of heroin with fentanyl and other drugs, other synthetic analgesics, which makes it especially dangerous to kids. Fentanyl makes the properties of heroin 50 to 100% more potent. So it's very easy for a child to overdose easily, thinking that they are using heroin alone. So the article is helpful, I think, to parents, and hopefully will be a tool for you to use in talking to especially teenagers. What we've seen at my organization is that by the time a person is referred to us, very often they're involved with the criminal justice system, or they are involved with Child Protective Services. Yet when we did a survey of the people at my organization, they all, without fail, reported that they started experimenting with drugs when they were in middle school. So it's 7th and 8th grade is when this begins. So it's something to really be aware of and to always be talking to kids about, because what typically happened is they started using in 7th and 8th grade. They report in retrospect that they lost control while they were in high school. And of all the ones that ended up in treatment at our agency, 90% had gone to college, but only 10% had completed because the addiction took over. What I would like to talk to you about today, as we move along, is addiction as a disease process and also as an intergenerational process that frequently can occur in a family, and how families organize themselves around the addiction, and how help is needed early on to help families to not do that, so that recovery is more accessible to everyone. So that's what my focus is going to be. We do prevention services for children, and we also treat adolescents and young adults, and we work very closely with parents. So I hope that we have a productive evening as well, and I wanted to thank the Senator for everything that he's doing to support us.
I'm Pam Stark. I'm a detective with the Nassau County Police Department. Thank you, Senator. We work together today. Just briefly, since both the panelists had gone into the addiction part of what they see on the clinician end, the police department has, 2009, in the fall, commanding officer of community affairs, Lieutenant Gary Shapiro, he had spoken with me about a new position within the police department, going into a three-prong approach. Enforcement, of course, as you know, Nassau County, that's what we do, to arrest and to have safety and protect the public. And I kept on hearing so many times from my higher brass, we can't arrest our way out of this, Pam. We have to find a different venue. We have to find a different approach. And so they came up with an unusual position: education, awareness, knowledge, and every day I'm learning. So they worked together with people like LICAD, and they came up with an educational curriculum, which is K through 12. And no, the police department do not teach within the school. We certify schools, And to date, we have certified every school in Nassau County. We have 56 school districts. Many of the parochial schools. I am going after the private schools. So it's a 2-day training that I hold. First day is K through 8, second day is high school, and it's called Too Good for Drugs. And once the school is trained, the curriculum is paid for by asset forfeiture funds, which is money from drug seizures. So it's like a perfect response. And then also in our educational package, we did Impact, which we worked together with people on a steering committee of people in recovery, many who I've met, and told us exactly how to touch a young person, how to not make that first step up the stairs. So that was geared towards middle school, but again, every school is able to bring it into their school district as they like, and it was hand-delivered to every school district in Nassau, also at no cost. So trying to give back. And from every person that I've met, being in this position and working very closely with many people in narcotics and many people in recovery, many families that have lost their loved ones. First off, I'm not, there are people within my family that are dealing with this also. So I don't know of too many people that haven't been affected by it. So I came together and I put together an awareness presentation, and I worked with, last night I worked with LICAD, and I did something in Rockville Center School, so pretty much all over. And thank you. Thanks for coming.
Good evening. My name is Tom DiPaolo. I'm the principal of Carl Place Middle and High School. And on behalf of Mr. David Flatley, our superintendent, we thank you for allowing us to participate. Carl Place is just down the road. It's a 1 square mile school district, one of the smaller school districts in Nassau County. We have 660 students total, 7 through 12. We pull from, of course, Carl Place, a few blocks of Mineola, and a few blocks of Westbury. And just the other day, Senator Martins was in my school, and we had something to cheer about, which was a student who threw a no-hitter and 21 strikeouts. Never happened before in New York State. Tomorrow, I'll be seeing Senator Martins, probably at a funeral, at a wake, because one of my alumni passed from an overdose. That was just Sunday. Today, as the high school principal, I was dealing with the aftermath of that, and dealing with the kids who knew the young person who passed, the siblings and all that. And when you throw a rock into a pond, there's lots and lots of ripples. So today it was patching up some wounded hearts today. So it was difficult. One thing that one of the panelists talked about was how early it starts. I say that the summer between 8th grade and 9th grade is the key summer, is the key time when kids will dabble, will attempt, will try, and that's where they start the road. What we find in our school and in the schools that I've worked in the last 25 years is in middle school and high school it's marijuana and it's alcohol use, and then it gradually goes. So this is my second year at Carl Place, and this is our second overdose, and both of them were alumni, young adults, not members of our community, as a student. So I'll share with you some of the other things that we do, but when I was invited to this, to tonight, my life has changed because of substance abuse.
Hi, my name is Michelle Medoff, and I'm Miss Long Island 2014, and I want to thank Senator Martins for having me on this panel, and thank all of you for coming. Most people have no idea what Miss Long Island is, so in short, I ended up here because I competed at the Miss Long Island pageant, which is a prerequisite for the Miss New York pageant, and you go in with a platform, and mine was substance abuse because for my entire life, I grew up this close to substance abuse. My brother was an addict for a very long time, and after what we thought was about 2 years of sobriety, but 10 years of an uphill battle, he passed away 7 months ago at 24 years old. So this is a topic that hits very close to home, and the family that all my fellow panelists have been referring to, the family who has to make funeral plans for their young loved ones, that's my family. And I've been blessed to have the opportunity to speak so openly about my own experiences because I truly feel that I've had the privilege of helping people who are suffering with what I've already been through. And the thing is that it's so frightening that there's all these ideas about how we can stop substance abuse and what we can do to help people who are suffering, but it's almost like it's evolving faster than we can keep up with it. One of the panelists said that it starts with dabbling and marijuana and alcohol. And yes, that's true in a lot of cases, but I work very closely with 13-year-olds who look at me kind of like a peer. And at this point, some of them are going straight for pills, and it really blows your mind. But I feel like from my angle, I'm not, a law enforcement officer. I'm just a kid. I'm a senior in college, and I'm able to really see it eye to eye because it's not hidden from me. And it's incredible that after my brother passed away, and I guess that's really when people found out that he was an addict, I can't even tell you how many people were like, oh, my brother's an addict, I'm an addict, what do? I need help. And to me, that's the biggest problem because it starts 1,000 different ways, but the stigma is really what keeps people from getting help.
Hi, I'm Stephanie Johannan. I'm the Director of Health, Physical Education, and Athletics in the Port Washington Schools, which is about 7 miles up the road, and Senator Martins is our senator, and thank you very much. And additionally, in my role in administration in the Port Washington Schools is I'm the co-chairperson of our Safety and Substance Abuse Task Force. My other co-chairperson is the Board of Education president, and it really just happened that way. But as a director of athletics and a board president on a Safety and Substance Abuse Task Force for the school district, we reach out to all constituents in the schools. So we don't make policy or curriculum for our schools, but we infuse education throughout K through 12. So the people on our committee, we meet during the day, their parents, their guidance counselors from each of the 7 schools that we have in our district, HSA presidents, PTA presidents, and anybody from the community that wants to be there. And what we do at our meetings that meet every 6 weeks, we just talk about issues that are in the school, things that we're seeing, and trying to bring in programming or instill just a little more emphasis on what we're already teaching in some of our classes. So, for instance, our health classes, health is mandated K through 12. We teach health in 9th grade and 11th grade at the high school and 7th and 8th grade at the middle school because that's where the kids really need to get that education. I totally agree with the middle school is the place where we're finding the experimentation, the dabbling, the pressure, the peer pressure, the esteem issues. Right now we're targeting in some of our most, I'm not going to say at risk, our most stressed parents are at the 4th and 5th grade level of children in 4th and 5th grade. So we're finding the transition years from 5th grade to 6th grade to middle school and from 8th grade to 9th grade in high school are the places where the parents are most stressed about how their students are going to perform, what they're going to see. And we give tools to the parents because we find out more and more the parents don't have the strategies to talk to their children. And the pressure of keeping up with their next door neighbor or having their children keep up in their classes or with their friends, it's very stressful, and sometimes they don't have the answers. So what we do as our task force is we're really in on all those schools, and we try to find the areas where we can get in and help to educate, help to prevent some of this, and whether we bring in speakers such as LICAD or Pam Stark or the police or somebody like Michelle who's really living it, it really is very effective in the different types of programming that we bring in. And we have many we're bringing in this year that I'll share with you.
Hi, I'm Kathy Samuels. I'm Project Director for the Manhasset Community Coalition Against Substance Abuse, also known as CASA. I just want to thank Senator Martins, along with Mayor Barbara Dono, as they are members, sector members on our coalition, and we appreciate being invited here tonight. Since 2001, CASA has been in existence as a 501(c) corporation registered with New York State Charities Bureau. And we strive to reach youth before they get in trouble by connecting with parents, school, as well as the overall community in our mission to protect youth from abuse, substance abuse. In September of 2013, we were honored to receive our second 5-year Drug-Free Community Support Program grant from the Office of National Drug Control Policy in the Executive Office of the President of the United States. Our goals are twofold. We want to reduce substance abuse amongst youth and over time adults, and more importantly, collaborate with the community to achieve these goals. The grant provides us with leverage in the community, again, to collaborate and to work within what we call our strategic prevention framework. It's a systematic approach to reducing substance abuse. We look to assess the problem that's within our community by collecting data on the issues. We look to build our capacity within the community so that we have partners and stakeholders who have a vested interest in working on this cause. We try to plan within a comprehensive approach that includes working with policies within the school district, as well as things like social host laws and practices that will create a logical plan to address our issues in Manhasset. We also seek to implement evidence-based practices in our schools. Pam mentioned Too Good for Drugs, and we also use for our K through 6 health a program through the Children's Health Market called The Great Body Shop. And in addition, we evaluate what we're doing. We evaluate to see if we're accomplishing the goals that we initially set out to do. So our efforts are also guided by a simple premise that to prevent the problem from happening, we really need to understand what's driving the risk behaviors in our teens and what's also protecting our kids. We work in coordination with Manhasset Public Schools, and we survey our teens biannually in 8th, 10th, and 12th grades, and we look to find out, again, what the protective and risk factors are for our students, as well as the extent of drug use in the past 30 days. How are the kids binge drinking? Where are they drinking? How are they obtaining their alcohol? And we also work with North Shore LIJ. We receive emergency room statistics to find out who is subjected to alcohol poisoning, as well as drug and marijuana overdoses. In addition, we work with the Nassau County Office of Chemical Dependency, where we find out the extreme rate of treatment that people are seeking and needing. So with our local data, we're able to devise strategy, again, specific to Manhasset. And what we're trying to do, again, is to modify the setting of the environment by which drug and substance abuse lives. We're trying to change the environment. Since 2008, under this Drug-Free Community Support Program, we have contributed to reductions in 30-day use of alcohol for grades 8, 10, and 12, as well as reduction in tobacco and marijuana use, as well as risk behaviors like riding with a drinking driver. Again, thank you for having us here tonight, and we look forward to the rest of the discussion.
Thank you. Thank you very much. You know, I hope everyone caught the age groups we're talking about here. These are 4th and 5th graders. These are 6th and 7th graders, 8th into 9th grade. For the most part, on the lower end of that scale, they're not even teenagers. And so when we think about this, this is in our backyard. So I'm going to try and be as provocative as I can, and I'm going to ask, because this panel is exceptional, I'm going to ask you to kind of join with me a little bit, and let's go through a couple of scenarios. So if I have a child that is 14 years old, 8th grade, going into 9th grade, and I suspect that my child may have a substance abuse problem. As a parent, certainly, I would have the ability to go to a healthcare provider and have my child tested to make sure that my child, or to verify whether or not my child is abusing drugs. Wouldn't that be right, Dr. Reynolds?
Yes, but, and here's the but. I think all of these things have to take place in a context of a rich conversation, right? So my sense about drug testing always is if you're drug testing your kid, there's a reason, and odds are that test is going to be positive. I always tell parents, look, trust your gut. It's going to tell you more than a drug test will any day of the week. I think that when we talk about young people, it gets complicated because the signs and symptoms that I would tell you to look out for, and the signs and symptoms that anyone on the panel would tell you to look out for, can easily be confused with something else. So, moodiness, big changes in friends, angry outbursts, a slip in grades, changes in financial status. What does that sound like? Kids, right? It's when you get into, I think, some of the more finite points around drug paraphernalia, around significant changes in friends, significant changes in financial status. It's the magnitude of those changes that gives you the tap on the shoulder. The problem is, these things don't often happen overnight, and it's a gradual process. Until you begin to pull it all together, you and me as a parent want to convince ourselves this is not what's going on, it's something else, I must be horribly mistaken, and how dare I think my kid is involved in things like this. It's kind of like if you put a frog in boiling water and you slowly turn up the heat, it boils. You throw him in, it's blazing hot, jumps right out. This is something that happens progressively over time. And before you trot your kid off to a healthcare professional, like some of us on the panel, it's important to have a conversation about what's going on, about what you're seeing, to talk about who their friends are, to talk about the way they appear. If they appear to be impaired, it's important to have that conversation. And that's not a single discussion. It takes place over a period of time. So what I'd say is, yes, you can bring your child to a healthcare professional. Yes, they'll test them, and yes, they'll probably confirm what you already suspect. But there's a whole bunch of stuff that happens before you do that, and then I think there's a whole bunch of stuff that happens afterwards. I've seen parents who have, run home with a drug test and gotten their kid to pee into a cup, and they've gotten the results, and the results are positive for opiates. Now what do you do? So before you do that test, I would say have a game plan. The fact that it's negative, you shouldn't be dancing in the streets, because it's negative for a point in time, right? And you want to make sure it stays that way. Same thing if it's positive. Right, you want to have a game plan, and you want to make sure you have a support team out in the community to go to as you walk this road. That's my 2 cents on it. Should I pass it down to Maria?
Well said. Well, let's assume that we have had that conversation now, and we'll carry it forward, and we've determined that our child, much to our surprise, has dabbled, as has been used in the past. What should we do as a parent? What is our approach?
Okay. The first thing is that I think is really important to understand is that addiction exists in a context. So if you have a 14-year-old or a 15-year-old and you're concerned that they're using or they're dabbling, it's also important to look at the larger long-term clinical picture and what intervention and what support and what help is going to be gotten, not just for the child, but also for the entire family. I've been treating addictions for over 20 years, and in 20 years, I have yet to see a child who is addicted, who is not living in a home where there are other types of addictions. And one of the mistakes, I think, and one of the dangers that occur in families is that we draw a distinction between alcohol and alcohol use and other substances. We also draw a distinction between prescribed medication, which obviously is legally prescribed, and other substances that are obtained illegally. Yet it's often the combination of those things and the context in which things take place that can lead to the addiction process. So what I would suggest to parents is the moment that you become a parent, before you get to age 14 where you think there's a problem, but the moment you become a parent, it's important to do a real inventory, a real analysis of what goes on. Who do we surround our children with? Because every single person we surround our children with should be someone that we want them to emulate. So are we drinking a lot at the family barbecues? Are we allowing our children to be around people who are intoxicated? Do we know that Uncle so-and-so or Aunt so-and-so has a problem with prescription medication, yet that person is around our child and we're not having a dialogue with our child, because a lot of it is about education. Addiction is, as far as we know at this point, all the literature points to a very strong genetic link and a very strong biochemical link. It's also comorbid. It exists very often with other mental illnesses, so that if there are people in the family who are depressed, if there are people in the family who are very anxious, if there are people who suffer from bipolar disorder or have post-traumatic stress, those are neurologically oriented diseases that are correlated with addiction. And we can almost predict if a person is very anxious, they're usually using a central nervous system depressant. If they're very depressed, they're very often using a drug like cocaine. So that clinically you pick up those things. So just knowing your family and doing a thorough history and analysis of your family so that you know what to educate your child about when they're very young, gradually with constant dialogue and conversation, like both the Senator and Mr. Reynolds, Dr. Reynolds was saying. That's very, very important.
You know, Tom, no, Principal DePaula, you mentioned earlier how education is a component, and certainly we've heard education as a component here. As a high school and middle school principal that is dealing with this issue currently, unfortunately, but certainly over time you've been exposed to this issue. How do we address that through our educational system?
Right. So there's two parts to that. There's what we're dealing with now in Coral Place, the reaction to an event, and that can either be something as tragic as a young person dying, or even we suspect that a student has drugs or drug paraphernalia on them. And then we deal with the event afterwards. So what I say to parents is, you have them for 16 hours a day. I have them for 8 hours a day. And so they spend a lot of time with me and my people. So we can pick up on things that they may not. And so when we do have a suspicion that something is going on, whether it be in the building or outside the building, because kids are pretty transparent, we have professionals in the building who are trained for that. We have on our staff, we have one social worker and we have one school psychologist. So our social worker would be the person, our contact person, that would make the connection for the parents to people who are on the panel, to healthcare providers and things like that. The first part of it is what the business that I'm really am in is the education part of it. So like one of the other panelists, we have health courses that teach the students the theoretical part, the practical part, what opiates are, what depressants are, and all that. And it's a mandated course through New York State, so we have it in 7th grade, and then we do it once again in the high school. We also have we have assemblies that deal with these kind of things. Most schools in Nassau County, if not all Long Island, have a club that's geared towards these kind of issues, and that's sad. When we were younger, it was students against drunk driving, but now it's students against destructive decisions. And that club is solely for this purpose, to educate our students about the uses of drugs and other things. So one thing that we do in Coral Place, a lot of other places do, we have Grim Reaper Day, which was just last week, and every 31 minutes a gong sounds over the loudspeaker to represent the teenager who every 31 minutes dies from drunk driving. And then all of the students who are participating are in blackface for the day. And then at the end of the day, we talk about that kind of stuff. We have contracts in the beginning of the year for students. We have pre-prom meetings. We have a new program called the Red Watch program, a Red Watch Band program, where we taught students about binge drinking and the dangers of that. But now we're teaching the bystanders what to do when you see somebody at a party who's the binge drinker. Instead of propping them up or trying to pour coffee down their throat or throw them into a shower, all of those things are dangerous. So we're teaching our young people about that as well. So, but probably the most important thing that we do as educators is the relationship that an adult has with the child. And when I hire new teachers, I try to hire those that really love kids. Because I can teach them to teach, but I can't teach them to love kids. And if we have those kind of adults in the building who can make those connections with the kids, it makes these kind of situations, both the before and now the after. Because the 4 girls that were in my office crying because of the situation today, just a few hours ago, I have had that relationship with them, that they can come into the principal's office and cry. Usually when you come to the principal's office, you're crying for another reason, but for this reason, those relationships are really important.
Thank you. Ms. Joannan, in Port Washington, obviously, there's a need in every school district to the extent that there's already been an approach to creating, an office for this particular need. What have you seen as the challenges in the community? Has there been pushback, and where have there been successes?
I think where Tom hit it was the adults that you have in the building we send the message at every level. If you have an issue on anything, who's the adult in the building you most trust, and go to that person. In the high school, we find it's usually the health teachers. Second is usually the guidance counselors. At the middle school, it's the guidance counselors and the phys ed teachers. At the elementary school, the guidance counselors, the trusted adult. And then sometimes, a student will go to an adult and they just don't get that feedback that they need, or that what they need, and we'll tell them, you just went to the wrong adult, find another one, because there is someone that they can trust. I said, that's number one. The social worker we have in our school, you asked about the pushback. We added a social worker 3 years ago on staff, full-time, part of the OASIS grant, and we work with LICAD. We found originally the social worker had like a stigma, like, when do you go to the social worker? And the only people that go to the social worker are the ones with the problems, because it used to be next to the psychologist's office. Now we put the social worker next to the guidance counselors, so when you walk in, it could be for any reason, and that's how we view our social worker. Her office is right in the middle, painted, it's beautiful, and as people go in and out of guidance counselors' offices, they go in and out of the social workers. Whereas on the room in the hallway with the psychologists, a much different feel, so it's much safer there. I think what we do once a child or a student goes to the teacher, that's the place where we're still growing as a district. What do we do? Because unless it's something, as Pam talked about, criminal, we really don't want to suspend kids, go out for 5 days, and when they come back, have no educational component. So right now, when they come back and they must see the social worker for a certain period of time. Same thing with our athletes. If they get caught, something, Instagram, social media is almost out of control. But sometimes if we find it even out of school, we may suspend an athlete for 2 weeks from a team if we find with a red Solo cup in a picture. But when they come back, or, it used to be we would kick them off because you can't drink and do drugs. Now we take more of an educational part of it. We may suspend them for a week or 2 weeks, but they need to talk with people, go back to their team, and we talk to them, because sometimes with kids, it's not punishing them. It's really trying to save them and educate them. And that's where I think we've gotten our secondary levels on board, because the kids are involved with more extracurricular activities. And I think you find out when you take those away from kids, they get into more trouble. You know where they are for 2 hours a day with a team and who they're with. When they're in a club, you know where they are. So we hope that we can try to teach them to make better decisions. So we do more in the schools with our social workers, guidance counselors, and teachers. And, that's where we are, and then we bring in programming.
No, I appreciate it. Just as a quick follow-up, we hear all too often that there are issues that are affecting our communities having to do with prescription drug abuse, with specifically in many instances opioid abuse, or transitioning to heroin abuse. If we get beyond, not to make light of it, but if we get beyond the alcohol and the recreational marijuana abuse that we've talked about and been referred here, how does a school handle that? When you're either aware or a child comes in and says, I have an issue with prescription drugs, I have an issue with opioids or with heroin specifically, what is the position of a school, and how do you handle that?
if they come to us, what we'll do is we'll refer them. We have port counseling in our town. We will refer them outside. We've gone to LICAD, and that's where the social worker comes in. If they come to us, we will definitely look to help them, and we'll look to refer them. The other part is we always call their parent. You know, we'll talk to the student, but the parent is such a critical piece in this that we'll bring them in at some point, either that time or just before the referral.
I appreciate that. Michelle, thank you very much for being here. I appreciate you joining us today on this important topic, and obviously a very personal topic for you. You know, as you went to Great Neck Schools, you graduated from Great Neck Schools. Was this an issue that was, you know, on the map when you were in school?
Truly, no, it wasn't. I feel like heroin and opioid abuse specifically has been something that's come up in the last few years. Of course, drugs were an issue. My brother was doing drugs since he was about 14, and he was at Great Neck North. And the thing is that when I was in high school and he was dealing with all of this, it was like they were trying to arrest their way out of it. So it was like always punishments, and you know, my parents would go pick him up from the principal's office in handcuffs for marijuana possession. And not that it's fine and peachy for a 14-year-old to have marijuana at school, but I feel like putting it in a kid's mind that they've done something criminal, that they're in handcuffs, I just feel like it's the wrong approach. And unfortunately, I mean, we had health programs, you know, those mandated health courses are not new, but I feel like the approach needs to be different because they were almost laughable when I was in high school. They were just cheesy films, and it was kind of like you'd hear people say things and you're like, oh, well, that's not me. I don't have to worry about that. About anything, sex ed, drugs, alcohol, everything. So I feel like a good way to move forward in that would just be to make it more interactive, make it hit closer to home. But as far as specifically the issue of heroin being on the map, it's definitely a newer issue. And like I said before, the drug abuse issue as a whole is something that's just moving forward so rapidly that it's hard to keep up with.
Thank you. You know, it's been mentioned before, less than a pack of cigarettes and will kill you and destroy your life quicker than you will believe. And so Detective Stark, you know, being involved in and around this issue, you know, we go back years on this particular topic to my years in Mineola, and you know, things, if anything, have begun to progress more rapidly as it has become almost more mainstreamed as kids and their access to these substances is becoming ever more real. How do we approach that so that, you know, obviously there's a real concern with criminalizing the issue, dealing with it separately as a healthcare issue, as we do with other healthcare issues, and understanding that there has to be an opportunity there to help the child and to get that child beyond the place where they happen to be at that moment. From a law enforcement standpoint, how do we do that? How do we transition and get the child the help that they need while at the same time understanding that there is a bright line out there for law enforcement when it comes to drugs?
Well, first, you're explaining somebody who's already made a mistake and has now come into our world, the
Right.
enforcement. Okay. First off, the people that I've met and many people that I've worked with are in recovery. Lovely people. I've never met anybody I haven't liked. And it's not their choice to become an addict or become addicted. It was not their choice whatsoever. We have something in New York that the DA's office works with, and it's called diversion court. And I've had the pleasure to be on a panel with Alva Ann, and she'll answer so many questions. Like, we'll do a panel where the county exec's office will work on it, and it'll be myself and somebody from drug court, and then we'll have somebody from probation, and we'll have somebody, a clinician, answering the questions. But they have made avenues where if a person has an addiction, well, they'll work with them through diversion court. Of course, being law enforcement, a police standpoint, I don't get that much involved with the DA's office. That would be more of a DA's question, but I've seen many people work through the court system and it has done well. We've kind of changed it, where it used to be everybody was prosecuted. Now they're taking the person that has an addiction and helping them. When I was on patrol, many times when I've responded to a call had to do with alcohol or drugs. And I don't think that person, if they were straight, would have called me. So we do know it. We're human beings that are responding.
I appreciate that. Dr. Reynolds, you've spoken to the increase in volume for your agency, certainly over the last few years, and how that volume has focused, to a large extent, on the increased drug abuse epidemic that we're facing in our communities. What are the challenges to getting a child, an adolescent, a young adult care? They've made the decision where they need help. The parents have had that conversation with their son or daughter. And after a period of time, they've had that breakthrough. It happens. The son or daughter is willing to accept help. They're going to an agency. What happens?
So generally, the best course of action is that there's an evaluation. And the evaluation is a pretty extensive process that might even take place over 2 separate sessions, in which a clinician has a conversation with that young person about what's going on, what's the drug of choice, what's the duration of use, how much are you using, why are you using. There was a great image today that a young man used at our seminar this morning. He's a young man in recovery, and he said it was like there was always a rock in my shoe that I could never get rid of. And it was I'd never heard it put that way. It's very artful. And if you ask young people why they're using, it's not to get high, it's not to fit in, it's to just feel normal. And for most of them, that begins with the dopamine boost that you get from energy drinks or tobacco or alcohol. And as your need for that dopamine boost increases, and your brain is still developing, you go bigger and better and badder, not to get high, but just to feel normal. You know, we used to separate these things out and say there's a biological basis for addiction that has a lot to do with the developing brain and genetics and everything else. And then there's peer pressure, right? So we call that the social piece of it. Well, lo and behold, there's a fair amount of research now that says that the approval of your peers gives you the same dopamine boost that you get from drugs. That feeling, that rush you get inside, particularly as a young person who's very unsure, who's very insecure, is exactly the same rush, and it multiplies whatever you're feeling as a user. So the evaluation happens over time, and there's a conversation. If a kid says, look, I'm anxious, I'm depressed, that's why I'm using, we know there's more than one thing going on, and in 99.9% of these cases, there's something else going on. I will tell you that for most parents, it's easier to say, my child has made a series of bad decisions rather than they have an undiagnosed and untreated mental health condition. Mm-hmm. And parents will fight to the death and say, I don't want my kid to have a diagnosis. Until we get to some of those issues, then we're patching them up for the next time. And it's like playing whack-a-mole, right? So it's going to come out somewhere in terms of dealing with that depression, anxiety, and everything else. From there, and here's, there's a ton of press out there that talks about all the barriers to care. And I can go on and on, in fact, I probably did today, about insurance companies and the practices on the part of insurers. Even with all the barriers in place, there's never been a person that we haven't been able to get into care. It might take longer than it should, but we can find a placement for everybody. And so care could be any number of things. Care might be psycho-educational support groups. If you come into us and say, my kid smokes pot once a week, he drinks on the weekends, it's not going to be treatment eligible. We can debate whether or not he should be, but at the very least, we're talking about a 10-week class in which we talk about the impact of drugs and alcohol on your body and why you're kind of going down this road. if you're using, at the other extreme, 15 bags of heroin a day, we know we're looking at a longer-term inpatient, potentially residential kind of scenario. There is very specific criteria about this. So no patient comes in and says, I want to check out for 60 days, I'm gone. Right, so that's usually a conversation with them to talk about, this is what you're dealing with, here's where your prognosis looks best. Let's talk about what your insurance will cover and what you're willing to do, and it might not be perfect, but let's cobble together a care plan that works for you and works for your family. That's tricky because this is the only disease that will tell you and your family time and time again, you don't have it. Right? So imagine, we have folks that leave treatment all the time. We spend weeks and months setting up treatment for a young person. These are not locked units, so a week later they split. Can you imagine a chemo patient who's 2 treatments in just kind of unhooking and taking off? Right? This is the only disease that works along these lines. So it typically is a process. It's something, I hesitate to say this because I'm for kind of empowered consumers and parents and everything else like this. It's tough to navigate it on your own. This is not a user-friendly system. We all use acronyms. You can look online and find 1,000,001 treatment facilities. Some of them are great, some of them are terrible. There's no relationship between price and the quality of care. And if you have someone, whether it be somebody from the school, somebody from a community-based organization, someone from a treatment facility to help walk you through the process, first to prop you up and assure you that you're doing the right thing and that your gut instinct is correct, but second, to navigate some of the potential landmines on the list, you're going to have a much easier time and it'll be a smoother experience.
Thank you. Thank you. Kathy Samuels, with CASA and dealing with many of these same issues and that same age group, just talk to us a little bit about the efforts, not only for the group, but the ability that the group has had to reach into the student body, get proactive participation, and create that sort of reverse peer pressure that we need in order to hopefully, help people get beyond the drug issue or at least avoid the drug issue. What has your experience been with CASA in Manhasset?
Well, I'll tell you, we've organized ourselves under 4 committees, first and foremost: school, parents, community, and youth. And I'd have to say, out of the participants who are involved in every other committee, it's very hard for youth to come forward and to be a part of this drug-free world because amongst their peers, it's cool to be underage drinking. It's cool if you go on social media. If you go to SUNY Pound Stories on Twitter, you can see what's going on at all of our SUNY schools as far as underage drinking. We heard about the Long Island Twitter stories last week where all of the high school students were posting all of their escapades in compromising positions. You had children passed out, girls, boys. So from a youth perspective, everything tells them the opposite of what we are trying to convey, every one of us here on this panel, because of social media. Within the schools, I know we were talking about different aspects here. Manhasset Public Schools, again, we utilize evidence-based health curriculum. Too Good for Drugs is incorporated in. And again, these are ways, these are true, proven strategies and curriculum that can help reduce substance use, can help increase protective factors for kids. And with parents, your previous question, parents need help. Parents need help understanding how to talk to their kids. And we've been very fortunate to work with our public library system to bring in a Power of Parenting series to address not only how to identify kids under the influence of drugs, but how do I talk to my child? When do I talk to my child? And many parents are surprised that you should be starting to talk with your kids as early as nursery school, age 3. We can set limits. We can talk about discipline. Because when you wait until children are 13 and 14 years old to start talking about rules, talking about your values and what's going on in the home, it's almost too late. It is too late for many parents and families. But for youth, I think it's very difficult for youth today to stand up and say, I'm drug-free. Certainly, the principals can attest to that too, possibly. But social media is very, very strong out there, and it's painting reality. Television paints another picture, too, about what's cool and not cool.
Thank you. Before we continue, I'm going to ask if there's anyone who has any questions. Certainly, please feel free. Either you can write them down, or as we go through, I encourage everyone to participate. Please.
From a legislative point of view, I personally believe that the heroin epidemic is fueled by the powerful pharmaceutical narcotics that come onto the market. I think that's confidence with that. And, they were available, but at $80 a pill, they couldn't afford it anymore. And then they started to get heroin, and it was $20 a day. It is just not until now that New York has a computer system. I'm a physician. I want to put a patient on Accutane. I have a DEA number. They have to be registered. What is the problem with registering patients who are opiates in the same way? Shouldn't there be a federal registration for anyone who's prescribed an opiate to stop them from doctor shopping from state to state?
I agree. There should be a federal system. There is now a state system. For the last 18 months here in New York State, we have the iStop program legislation that passed that requires just that. And it has been very effective by most measures. But one of the measures that, and one of the side effects of its effectiveness is that exactly what you mentioned earlier. Those who are dependent on prescription drugs and opiates have now transitioned because the dependency is still there. That transition is now towards heroin, and when it's as cheap and readily available as they say it is on the streets, it's a real problem, because when you transition from prescription drugs, which I think many people believed were okay because they were doctor prescribed, and why would a doctor prescribe something that was going to be bad for us? And then now you're on heroin. It's a significant difference. It is and has led to significant problems. And if we go back to our discussions at our forum that we had today, the reality of parent after parent relaying the tragedies in their lives of having lost a child at an early age due to an overdose, heroin or opioids. The realities of how many there actually are out there. And we heard statistics of 121 in 2012 and 120 in 2000. That doesn't count all of the overdoses where the life was saved, the hundreds and hundreds of overdoses. That is the reality we're dealing with today. And yes, we've heard about how we're dealing with it through our schools and how through communities and parental outreach and working with our kids. But the reality is it exists. It's in our streets. It's in our schools. It's in our communities. And I guarantee you it's in each and every one of the school districts that are represented at this table right here, although we've talked about marijuana and alcohol, and we really haven't gotten into the specifics of heroin and opioid abuse, but it exists. And so legislatively, one of the challenges, and the reason we had the forum this morning and the reason we're having the forum here is, how do we go back? How do we start setting different policies on a state level that allow us to begin providing the tools that we need as communities to address these issues? And there were some real powerful points that were made, and we will get into them hopefully as we go through this forum, because at this point we've sort of been brushing against the issue. But there are some issues that we really need to dive into a little more deeply that have to do, as Dr. Reynolds mentioned, with insurers and how they handle health care coverage for those who are seeking help, for those children who have made that decision that they want help and have stepped forward and said, I'm ready, and then the insurer says, you're not medically qualified. How do we deal with that? And we should be able to deal with that from a state policy perspective. How do we deal with issues in schools where we provide for the tools in our schools where administrators, social workers, teachers can provide that support structure so that if a person is looking for help, has reached out for help, is going for help through one of these wonderful agencies that we have, and they're still in that same environment, that they're not going to be susceptible to falling back into those same routines that led to the issues to begin with, so that that support structure exists. These are all part of that discussion. So thank you. Thank you for that question. Yes, sir.
With respect to legislative issues, with insurance, we had somebody go through an inpatient program, it was 28 days, and I asked one of the people at the end, I said, why 28? Where'd that number come from? Insurance.
Right.
Is anybody attempting to do anything to lengthen that? Because at 28 days was not enough by any means, and most people we've spoken to said it's a joke. Luckily, we were able to get them into a 90-day sober house, which is another issue. How are those controlled? And I think it was a Newsday recently, within the last 6 months, had a big article on sober house. You get somebody, maybe on the right path after these first 28 days, and then they wind up in a place where it's more available than on the street. Take anybody in the room out of it.
Thank you. Thank you. That's the question. Let's go at it. That's the question. Medical necessity. Each insurer gets to decide for themselves what is determined to be a medical necessity. So if you happen to be insured with a company, if your family, if your parents have insurance through a company that has defined medical necessity in a way that makes it impossible for you to ever qualify, how do we deal with that societally? Because it is unacceptable that we have such different standards. 28 days, 90 days. We had a young lady this morning who was the very first person to speak at the forum. Her name was Shanna, and she now has a 4-month-old daughter, and by her account has survived what very few people survive. And when she was ready to get help, wanted help, she was told by her insurance company that she was not medically qualified. It wasn't a medical necessity. And so she fell back in, and then she managed, through the grace of God and circumstance, to extricate herself when those around her were dying as a result of their addiction. So that's the issue. As a state and as a society, Michelle, how do we handle that?
Well, I've seen so many cases like that. A friend of mine, her daughter went to I want to say 30-day facility in California that costs as much as college tuition at an Ivy League school. But she had high hopes for it. It's so well known, and she came back, and while she was there, she was doing great. She was so well liked. But I feel like that comes back to the issue of feeling normal. And when you're in a closed place like that, of course you feel normal. Everyone's just like you. And within days of her coming back, she was just right back addicted, worse than she was when she left. And even with my own brother, I've seen it. He's gone to countless programs. He went to one when he was 14, 17, 22, and it's this catch-22 because you're talking about 28 days not being enough. But so many of these cases, you said the average age was 25. So a lot of these people are adults, and you can tell them you need to go to a 30-day program. But my brother stayed for 5. He was 22, he was an adult, and he was like, I'm over this. So it's kind of like, how do you get the person to feel that they need help, but to feel hopeful that they can do something about it? Because that's one thing that I've always seen, is that the people who are going in and out of treatment feel hopeless. They feel like this is who they are, this is how they're gonna feel forever. And it's just not the case, but how can we help them to know any better than that?
I appreciate that. You know, you mentioned an adult and the adult checking themselves out. Something I came to learn through, our discussions is that anyone can check themselves out. A 13-year-old, a 14-year-old, a 15-year-old, a child that is in a program can decide for themselves, I'm checking myself out. And there is no obligation, no requirement that they keep the child there, even if the parents had wished it. These are some of the societal issues that we have to deal with. Where do we draw that line? Maria, what do you think? And when it comes to issues of care and setting policies, understanding that there is a real concern there and need for this treatment at a young age, what should the state's position be, and are we on the right track?
I think that we're not on the right track because I think that we're dealing with systems that put limitations on the length of care. And it could be an insurance company putting a limitation or an insurance company getting overly involved in dictating the level of care that a child or a family should receive. I think in addition to that, we're also dealing with a state system that licenses programs because our programs are licensed by New York State. And for example, the state will say to my staff, you can provide treatment in 90-day cycles. So after 6 months, which is not a long time if you're doing intensive outpatient at all, we have to justify why we want to keep a particular patient longer. And it has become increasingly harder to do that and more frustrating to do that. And at the same time, we're working with more limited resources trying to do it. As an example, we had a young man who had no family, he was homeless when we started treating him. He finally was sober, he was making progress, and 6 months had gone by and he needed to stay in the program. And we ended up having to discharge him and then admit him again a week later. Wow. So now we had another 6 months. But these are decisions that are not rational. And I think really professionals should be determining the length of care that a patient needs and the type of services that they need. It shouldn't be dictated by a person with no training, and that's what happens.
You know, I'm just going to follow up on a point that Michelle had made, and I'm going to go to Mr. DePaula. You know, when we talk about our teenagers, young adults that are still school age, and they go and they seek treatment, and they're in this program, and they come back, and they're right back in that same environment, surrounded by those same influences that put them in that position to begin with. You know, there was discussion, and there has been discussion, that perhaps we should have some alternate schools set up that will allow for a continuation of treatment, understanding that there has to be a break. Do you have any thoughts about that?
Yeah, even if it's not drug-related, but anytime a student is out for an extended period of time for discipline or anything, we always tell them that the first day is always the worst. Because as they walk through the hallways, all the eyes are on them, but it's not because of that, it might be something else. So it's difficult for them the first few days. As far as I know, we don't have anything right now in Nassau County for that, a separate school. We have a BOCES program, for example, for incarcerated youth. We have a BOCES program for kids who are vocational. We have another one for kids who are disengaged learner. We have a twilight school. We have lots of different programs, but we don't have one yet for that. I'm not sure. You know, in one aspect, I want them back into the mainstream. I want them back into where they should feel comfortable. It's not. I don't see it as one of the audience members said, a place where they're going to learn how to be worse in their drug addiction. The prison effect, where the prisoner goes into prison and then he comes back out a worse criminal because of who he's around. You know, a large percentage of my students don't have drug problems, so I want them around the mainstream. If we separate that child now and separate them into a school over here, all of Nassau County, I'm not sure if that's long-term the best treatment, best way. Short-term, maybe. For example, we have a program through Nassau BOCES for pregnant women, for pregnant girls, who about their 8th month, maybe the 7th month or 8th month, when it's unhealthy for them to be in the building, walking the hallways, they go to the TAP program, and they learn, they continue their education, and then they learn parenting skills. They give birth. 6 weeks later, they come back to the school, and there's a nursery for the kids to, for the babies to be there, and the mothers to continue their education. But then the idea is that that girl comes back to the mainstream school. She doesn't stay at that TAP program forever. So maybe a short-term revolving door kind of thing, but not long-term.
Sort of a transition.
Yeah, transition.
You know, the state, and we've talked about it, Bill, the state has a vested interest in this. You know, I spend a fair amount of time helping people transition off their private insurance plan who won't pay for an adequate length of stay onto Medicaid. I spend an awful amount of time talking to parents about how with an arrest comes a judge's order for treatment, and subsequently comes a requirement that the insurance company cover that. And so for many parents, particularly in this area, your child being arrested might be your worst nightmare. For parents who are walking the road of addiction with a kid, it frequently becomes your best hope for getting that kid care. I will say that a 28-day stay these days is almost unheard of. It shouldn't be. You've got folks, before they ever connect to care, have been using 3, 5, 7 years, and then we believe that it took you that long to walk into the woods, that we can walk you out in 28 days. When as a young person, a lot of your brain development has stopped during the period in which you're using. They don't have the same coping mechanisms, they don't have the same skills. It's next to impossible. And of course, we point a finger at them, and as does the insurer, and we say, well, it didn't work. You relapsed. Well, our relapse rates are upwards of 80 to 90% because we don't give folks enough treatment. That would be the same case with any medical intervention. That if you do it halfway, you can only expect halfway results. And so that's one of the reasons we've seen relapse rates that are so high. On the issue of sober homes, and I co-chair the Sober Home Oversight Board in Suffolk County, New York State should take an active role in regulating sober homes. The fact that they do not is absolutely criminal. And essentially, it's put us in a place where young people go off to what would otherwise be really good treatment. They come home, they wind up in a sober home because they can't return to where they were living before, and that investment goes right down the drain within 48 hours. And you've got folks that are making a killing, packing 10, 15, 20 kids into a house under very unsanitary and dangerous conditions. And so we know how to do treatment the right way. Very few people get the treatment that they're entitled to, and they'll flip open a benefits book and say, well, my insurance company says it, they'll give me 28 days worth of inpatient and 60 outpatient visits and detox. Yeah, just try to get those benefits. And as Maria said, it's not healthcare professionals on the other side of the phone making the decision. It's an actuary. Now, these are the same insurance companies, by the way, who year after year will pay for millions of dollars worth of pharmaceuticals as a young person gets addicted without ever asking a question. And suddenly we talk about a treatment stint that at the end of the day might run 10 grand, and it's a major problem. And I said before, addiction is different. They wouldn't get away with this with any other disease because people would be rioting in the streets saying this is just plain wrong. And so because the insurance industry won't do what they're supposed to do, we fill up the Nassau County Jail, we fill up the medical examiner's office, the crime increases in our communities, and families are left in turmoil. And in some cases, these families spend 3 months, 6 months getting that person to the front door, only to have the insurer say, nah, try outpatient first, let's just see what happens. And that young person looks at you and says, see, I told you were blowing this out of proportion. Even the insurance company doesn't think I need to go anywhere for 30 days.
And I will in just one moment. I just want to highlight a point that was made here because we have to contextualize it. Where you're better off arranging for your child to be arrested as a means of being able to get appropriate benefits than you would be if you sought care on your own. And that's not the first time we heard that today. And we heard it from people in firsthand accounts. That's a hell of a statement. And if we're there, and societally we're already making that commitment, it's not a financial issue. Societally, we're spending that money, whether we're spending it on our prisons or whether we're spending it in our hospitals, or we're paying for it already. The system is literally in a wrong place right now. And to the point that was made earlier, and I appreciate it, there is a concerted effort right now to do this, to go out, to hold these forums. The first one was today. There'll be 12 across New York State. There's a report that is going to be prepared by June 1st with legislative initiatives that hopefully we can all get behind, that will begin addressing issues like these, like the recovery homes that have become such an issue and that have fallen through the cracks. And then we wonder why people go out for 28 days, come back, and then find themselves in that same exact situation. We're losing our youth, we're losing an entire generation, and we can't afford to wait. Ma'am, I'm sorry, you had a question.
Right, I want to agree with Dr. Reynolds. I've been through the ringer back and forth. One of the hardest things for me to ever say, to be able to say out loud is my son's an addict. And I've gotten to that point. It's been 10 years in running. We've had Medicaid tell us we have to fail at outpatient first. Before, you're lucky to get a 28-day. We had to go to outpatient twice and fail. And like Dr. Lennon said, my son said it's a joke. So that spoiled him and his attitude, even trying to get better. We did the 28 days. I finally had to have my son arrested, just like you said, to get the help that we need. It's the hardest thing a mother has to do. So his son go away yelling obscenities at me for doing it. But it saved his life. He's getting treatment. He's been out of the house now for a year in treatment. He's in a Phoenix house. There's 100 guys jammed into a building. The facilities are dirty. My son is a germaphobe on top of everything else, so this was very hard. The calls every single night, get me out of here. Why are you doing this to me? It's been hard. And it's a revolving door. And something has to be done about that revolving door, because you get nowhere.
Please.
I really think that as a society, we have to embrace the idea that this is a disease. You know, when I hear this young lady say, he's 14 years old and here he is in handcuffs, this is a child in handcuffs. If he had a heart condition or he was a diabetic and his parents went to the school and found him in handcuffs, it would be so unacceptable and inappropriate. And when you said about stigma, people are stigmatized, and they're stigmatized when they're put into handcuffs. They're also stigmatized when we provide, as a society, marginal care that's punitive, that you have to fail out of, to then be able to provide them with more comprehensive care, which is still very questionable because we need more resources to do it right. When you talk about Phoenix House and having to put him there, I commend you because you have enormous courage to do what you had to do, given the limitations of the system. But I think that collectively we need to address this systemically, and it has to start with people really getting that this is a disease and that the family needs to be involved in the treatment and that the society needs to support those families while they're trying to get the help.
No question in my mind. He
Absolutely.
Has underlying, he
Yeah.
is self-medicating.
Yes.
For anxiety, for depression.
Exactly, and
until
it's
you
a
get
mental illness,
proper
yes.
help in
Yeah.
conjunction with
Yeah.
the addiction, nothing's going to
The other thing that I think is, like you said, it's like having a pebble in your shoe. The paradox about addiction is that the reason people are using drugs is because it's the only thing that makes them feel better. And it's not just what it's doing to them, which is destroying them, it's also what is it doing for them. And we have to address that and we have to treat it. We have to treat the underlying conditions that are going on with that person to help increase their chances of being able to put down permanently.
Michelle.
And that's...
Well, I think we kind of hit bingo with that one. you know, we all kind of in this room agree that stigma is a huge part of it. And I say this in the nicest, most least offensive way possible, but with all these programs separating addicts from mainstream schooling or having them leave school and come back, it doesn't help the stigma, because even if you're aware of it, it's still treated that way, even if it's not, you know, a 14-year-old in handcuffs anymore. Making a person feel stigmatized does only feed it. So I feel as though a lot of these programs, while they may be effective, it's kind of like you need to look deeper and see how this can potentially make someone feel stigmatized and add to the problem before it can help it, if that makes sense.
No, it does, it does, and I'll
Can I
come
just
back to
ask
that in a
one?
moment. Please, go ahead.
Your son, now you went through the court system, so you saw the diversion court, like, I'm not really that a part of it, but as I said, as a personal level, it will be this July. My godson is dead 2 years now from addiction. I watched Ryan, one of the nicest people in the world, get arrested, and his mom was freaking out. He chose not to use diversion. He chose to receive an e-felony and go to jail. And I, because I was in such denial, being Aunt Pam, was saying, Ryan, you're never going to be able to vote. And this was before I got involved in this. And he said, are you kidding, Aunt Pam? I don't care about voting, but I don't care about being straight. So give your son some, because he could have also, I didn't realize that there was that choice. So that was really great that he did choose recovery.
Well, he's presently in what's called the TASK program,
Well,
which is wonderful, and it's the first step that I've seen.
But remember, Ryan chose not for that, and that's lovely. And that was his 6th time of being arrested where he did do recovery. So that's wonderful.
We walk,
Good for you.
we walk a very, I think, a very fine line. On the one hand, absolutely, we have to overcome all of the stigma, and we should eliminate stigmas associated with what is essential, and I think we all can agree, is a healthcare issue. Just like any other. Just like any other. Just like if somebody was suffering or struggling with diabetes, we would be there with open arms to provide them with every resource. There is an opportunity there for us to do that. On the other hand, there has to be a line we draw and dissuade people from participating in that. And that is the balancing act, and we can do it. I'm convinced we can. There was a question over here. Yes?
We have talked a lot about treatment, but the forum is about prevention. And if it was a forum about preventing breast cancer or preventing diabetes or preventing high cholesterol, all of you would be up here telling us what we need to do to prevent this disease. Are you going to be treating 900 people next year? Is there prevention? Where's the prevention?
I think-
Education, knowledge, and
And education is not enough, because if you talk to Michelle, she would say, I know everything there is to know. My brother knew everything there was to know. Great Neck is a wonderful school district. We're talking about substance abuse prevention like Manhasset, like our place forever. With this issue, when we didn't want to have car accidents anymore, we all put on our seatbelts so we wouldn't go flying through the window. That was a prevention, that was a harm reduction. I still, with this issue, and I've been involved in this issue for many years, I don't see how can we prevent it.
We can measure the failures, right? Like I'll be measuring it tomorrow when I go to that wake, right? But how can you measure the successes? I can only hope that the measures that the school districts, that community organizations, that everybody else does has made a difference. But it's hard to measure,
Oh,
you know.
I believe that,
Right.
absolutely. I think you've made a great difference. But I go back to, when Jeff says, what is happening in our society that my patients are becoming more and more and more and more. What's the environment that kids are growing up in? What's the environment that your brother grew up in? that we didn't provide as a society what he needed.
Well, that's my biggest point always, is that my brother and I were not far apart in age. We're 2 years apart. We were raised by the same parents in the same house in the same town. We didn't go to the same schools because he was put in private school. But I think that it goes back to how can we make someone who feels not normal feel normal and feel accepted? Because I can tell you from as far as I can remember, my brother was 6 years old and just couldn't handle homework and couldn't handle mainstream school. So it's not something that we learned when he was 20 years old. It's from when you're young and you see it all the time. I mean, like I said before, I work with young kids who are middle school age, and I see it all the time. It's plain to see. I don't even need to talk to them. So I feel like working on truly how can we make people feel normal and feel accepted is step one.
How do we prevent them from getting the drugs to begin with? That is the biggest issue here that's not being discussed at all.
As someone in the throes of
I'm
that.
just saying.
No, I do appreciate that, the law enforcement capacity, the ability of law enforcement to stop drugs from coming into the country and preventing them from reaching our communities. That's the question, right?
It's a big issue. New Jersey, Colorado, these states that are legalizing marijuana. I mean, what's the next thing? What's the next drug that's going to be legalized? Because
And that is very much an issue. That is very much an issue in New York State. It's a well, it is.
state and,
It could be a federal issue, but frankly, for us, as state legislators that are being asked right now, and because there is legislation pending right now in New York State, and a tremendous amount of pressure and a tremendous amount of money behind that pressure to legalize marijuana in New York State. And it's passed the Assembly, believe it or not, at least 3-4 times that I've seen firsthand, and I'm sure many times before that, where they have passed it overwhelmingly year after year after year. And in the state Senate, when it comes up, it has yet to reach the floor of the Senate because there isn't consensus there, and there won't be consensus there. But that's an issue. Why are we voting for this stuff, and why are we allowing for a gateway drug to become available, and why are we mainstreaming a drug as dangerous as marijuana? Ma'am, in the back, you had a question. Yes?
I agree with this lady. The issue is the intervention programs, the health programs, all the stuff in school, and it's wonderful stuff, and I'm an educator myself, and it will help you and your brother. You learn this stuff, but you were not the potential addict. Your brother was. So you learned all those dangerous behaviors in school, so you graduated without drunk driving and things. But the addict, the future addict, is sitting there thinking now, oh, I've got the tools. I can handle this because I learned about drugs in school, so I can handle it. I can do it. There are no ongoing intervention programs to help a student, a young adult, an adult. That is the issue. There is no program. So you're going to see the rise of heroin in Long Island. It is not the programs in schools that's stopping it, because if it had stopped it when it was there 10 years ago, we wouldn't have the big increase now of the heroin. So we need to start having a real conversation about what to do and how to organize to get that stuff passed. This stuff is nice, and I'm sorry, it's feel good, but if your kid's a potential addict, all of this feel-good stuff is not going to help them. The mental health issues, the early programs that they can provide is the only thing that gives them a shot.
Let me carry off of that for 1 second, and we'll come back to a question right here in a moment. But let me ask the panel one question, and I'm gonna throw it out there. And I started off our discussion today in a very purposeful way by talking about taking your child and having the child tested for drugs. We all do blood tests. We have blood tests as part of our routine exams annually. We all do. And when they do, they check for all kinds of things, cholesterol and the like, they draw blood, and they check for conditions, for diseases, for cholesterol levels in the blood. Anyone ever wonder why they don't just test for drugs as well? As part of a routine. It would not last. All right.
Well, we were talking earlier about failing out of systems and that being a gauge for what works and what doesn't. My brother's death found a flaw in the outpatient system because he was an outpatient for 3 months, coming up clean every week, and initially he was being tested 2 or 3 times a week. And as you progress, your drug tests get less frequent. It's so much more complicated than anyone who doesn't think that way and have that capacity even can imagine. My brother was so sure that he could never overdose. We lost a friend exactly a year before he passed away. His name was Rob. Rob, everyone would look at, be like, he's doomed. Jordan, my brother, people were like, oh, he's fine. Jordan was so close with Rob, and he was like, this is what Rob did wrong. He used this much after being clean for this long. They have it down to a science. Obviously, that science is wrong, but it's so much more complicated than we're making it out to be. And, yeah.
Thank you.
Can I-
Kathy Samuels first. We'll come back to Maria and ma'am.
I just want to go back to your point about, how are we going to change this, change the dance? First and foremost, I think our schools and our society needs to acknowledge we have a serious problem here. Within Manhasset, we mentioned a lot of curriculum, policies, things of that nature, but we had a dynamic speaker come to our high school. His name was Chris Heron, and he was a former NBA star who was a heroin addict. And he spoke very plainly to parents and said basically, it all starts with the red Solo cup in the basement and the blunt. And it's what kids do on the weekends. When we look to see our laws that we have here, we have a Nassau County social host law. We don't have a New York State, social host law, but we would love to see something like that happen. Why? Because most kids are drinking in the basement in parents' homes. And that is where we see it starting. As far as prescription drugs, 70% of teens get them from friends and families' medicine cabinets for those kids who are abusing it. So what we've done since 2010 is we've partnered with the town of North Hempstead, Nassau County Police, our Parks District, to host pharmaceutical take-back events. We've collected about 1,300 pounds of pharmaceuticals just in Manhasset over the years. The town has captured 6 tons of pharmaceuticals. We've engaged a Lock Your Meds, Be Aware, Don't Share campaign because basically you've got to lock your medicine cabinets because that's where kids are getting them when they go to people's houses. They do it because they can. And in many ways, we enable our children to do it. So with parenting, with people like Jeff and Copay, like CAD and Copay, enforcement of our laws, as well as acknowledgement of the problem in our schools for parents too, not just the schools, because a lot of times parents say it's the school's issue. Why don't they do more education? That's not going to solve the problem. There's a holistic approach that has to happen, and we all need to work together, clergy, treatment, prevention, schools, government, to change the dance that we're doing, that our kids are doing here in the community.
I would like to speak. Go ahead.
I'm just going to, because this lady's...
I'd like to address your comments about the failed outpatient treatment, because I was about to speak to the same thing. I'm in the healthcare field myself. I find it extremely difficult to find a qualified person to help somebody to assess what their problem is. I have heard many, many, many parents say that they've taken their child from the age of maybe middle school, one person to the other, to say, I feel like there's something wrong. We don't know what's off. We can't get a grip on it. Can you help us see? And then one after the other says, oh, what a nice young man. Well, there's really nothing wrong. Well, this is their age. And it goes on, and then they get to be teenagers, and the next thing you know, we're in this whole situation. And still, as they go into college and they're about to show bursts of anger, there's no real acknowledgement, I think, among the healthcare professionals for a place for people to go to learn coping skills, which is something you would learn all the time, cognitive behavioral therapy. You have to search and search for these services, and first you have to know about them. And it's way beyond difficult for a parent to know how to get help. And if you go to a pediatrician, he might help you by testing for a drug, or it might come up negative. But even a pediatrician might say, well, maybe he's smoking some pot. You know, maybe that's what's doing it. That's why he's losing his ability to study in school, and that's why he's not doing well. I just feel like, as a professional, the professionals are really missing the boat in so many ways, and I have now had to learn, even within my own healthcare system that I work for, where the resources are. We don't even know within our own system where the treatment centers are. Where, you know, on Jericho Turnpike is the treatment center, right in Mineola, that we had to dig up to tell other people about. And, you know, it's just, that's where I think we need to start. I think we need to get, if you talk about the professionals, and, you know, getting them to be more educated, because they're not taking the reins either. And to the point where drugs are being prescribed 2 weeks in a row, one patient Vicodin, the same patient Percocet 41 week, 30 the next week, taking them to the same pharmacy and having those drugs, those prescriptions filled. 30 Vicodin, 40 Percocet within 1 week. And I actually, having grown up in a pharmacy myself, my father was a pharmacist, I actually spoke to the pharmacist and said, I have this patient, did he? And she actually broke a HIPAA law by saying, yes, I did fill this, and I did fill this. I said, well, what do you think about that? She said, well, that's not really that much. And the person was addicted, we found out. You know, and it's just like this kind of digging that infuriates me, because it's like we're working against ourselves, and we don't know how to offer the services to people. We don't have an open door. Your organization is trying to help, but most people probably don't know where it is, how to find it, what it, like as you described, you do an assessment. Most people don't even realize that that's available, or where you would go from there. And, you know, there is fear and there's mistrust also that maybe you'll take their child away, or you'll tell them to do something that they don't want to do. I think we need to form, you know, some sort of task force within our area, maybe get some more professionals involved, and really step it up, because we're not teaching it in the nursing schools. We're not teaching it, you know, the physicians I work with are prescribing, you know, left and right. Just today I heard somebody say, give them a good prescription, because we want to get them out, we want them to stay out, and they were talking about, you know, Percocet, Vicodin, here we go again. And there's really no effort made, even though it's been all over the media, to try to cut this back and to see how to help people catch it early.
Maria, did you?
I just wanted to, I guess, to speak to what both of you said, the lady in the back, and also to you. I would add to that, try to find a child psychiatrist in Nassau or Suffolk County that accepts insurance, because I can't find one. And they're not on insurance panels because there's such a shortage of them. So even things like that are like challenges. But I do think that what you were saying is very much on target, and also what this lady in the front said. What we're talking about is that there's a need to really acknowledge mental illness. That the child who has the rock in his shoe, like your brother, okay, needs early intervention, and those needs and those problems have to be taken seriously, and they have to be addressed clinically. And because it's a child, the entire family needs support, and the entire family needs help and needs assistance in creating an environment that supports recovery from the mental illness. By the time we get a kid who tests positive on a drug test, we usually have a kid who's been self-medicating for several years. And so then we have a dilemma, because as treatment professionals, they're probably caught in the criminal justice system. And as treatment professionals, we're saying you have to put down, because if you don't put down, you're going to get violated on your probation. You may end up in jail, and it's going to snowball into this whole thing. But what we're not acknowledging is that that drug is working for that child because systemically as a society, we have failed that child. And that's what we need to get. And programs like Too Good for Drugs, I think, are wonderful. I think it's great they're being done in the schools. I love that you're doing it in the schools. We also use the program at my agency. But Too Good for Drugs doesn't help the child who has mental illness. It will help those kids who, as a rite of passage, dabble with drugs and then move on to college and they stop using drugs. And by the time they're 25 and their brain is fully developed, they're not going in that direction. They're okay. But the child with mental illness will listen to that stuff and will use it probably in a way that's not helpful, or they'll gather information to figure out how to self-medicate the fact that they're miserable.
Yeah, but there's a lot of hesitation about bringing your child to a doctor who might then put the child on medication. And everybody's
Yes.
trying to hold off.
Yes.
Yeah, most parents don't.
Because medication, especially when it comes to children, is tricky because the brain is not completely developed until a person is 25 or 26 years old. So, but you have to weigh the benefits and the risks.
Yeah, but there is a middle ground. There are, I think, again, this could be the role of the psychologist or the social workers to be helping people, young people, develop more ability to deal with problems and to develop coping skills. Because their coping skill is to either drink or take away that rock from the shoe.
Yes.
But what they've discovered is it's a drug, and then it becomes an addictive situation. And
Some kids can be helped with coping skills, some kids need coping skills and family therapy and other and
First you have to
psychiatric
have
care,
the
but you have to
coping
figure out
skills
what
to
it is.
find
Yes.
out. We don't have it.
Right, we
Exactly.
don't have the resources in our
Exactly.
community.
Right.
We don't have enough places for people, when you, and the pediatricians don't know who to send
They
people to.
don't.
So it really needs, an education process for the professionals, if we're gonna pull them in.
I agree.
And then, of course, mental health or behavioral health is separated from the other health issues in the insurance business. You don't, you can't even call the same number to find out where is a substance abuse treatment program.
That's
as you
something
could-
that's
That's
very
separated.
important. Yes, it's very,
And
very
and they're starting to
important.
talk about putting it together.
Do you know, as the police department, when I responded, I was on patrol until 2005, and we would call it, we used 10 codes, and we would get a person who's a threat to themselves or another, danger to themselves, and it's called a 1062, a mental aided person. And you go, and it's high risk. And when we get into an ambulance, if I'm in the back with that person, your gun is not with you. Your gun is away, and you are with that person with the AMT on board. I can't tell you how many times that we were taking a person that were either under the influence of drugs or alcohol, and yet there were some, where, we're just police, we're enforcement, we bring them to Area 4, and a lot of times that person, now, it's a patrol car, 2 patrol cars pull up, and we drive by ourselves. One gets to drive the ambulance, I'm in the back with the AMT for safety purposes. Drop off the person, okay, we all get back in the ambulance, we drive back to that location, I pick up my car, that person's already home.
Yes.
I'm telling you the truth. And that's not because there's so many guidelines that, and what you were saying before, to give up, to be able to call the police. I have a 23 and a 24-year-old. And they didn't come with any guidebook either. And I want to tell you something, to be able to let go, to even say, I think my child needs help, is hard. It's a very hard thing to give up to a police department, to give it up to a doctor, to give it up. So sometimes we think, ooh, like my youngest, I knew there was something wrong, 18 months, I knew there was a developmental problem. But then I let them analyze them, and then of course I yelled at those people, and I was like, how do you know? What kind of medical insurance, where did you go for your doctorate? So we're parents, and we like to take care of them, we like to secure. So a lot of times the answers might be in front of us, but we're not used to it because it's not our norm. Just like it's not our norm to bring a person to Area 4 and know, I don't know for a fact, is that person, what is it a drug problem or is it a mental illness? And now I'm finding out more and more this co-occurring, and I can't tell you on patrol, we always saw it. It was just a matter of fact.
I have a question from a gentleman. Yes, in the back.
Thank you very much. Thank you for doing the seminar, first of all. I wanted to speak on, everything that was brought up. I grew up in Garden City, resident there a long time, from a family of physicians. I myself was in my last year of medical school when I got involved with opiates. I've been in recovery for a long time. What I decided to do was help save lives in a different way, and this has been a way of prevention, working with people that to educate them on that are already in recovery, and to talk to parents that have, like you've been saying, hush hush, things are okay on the outside, let's keep them on the inside. The mental health is a big issue. I suffer from anxiety and depression. I don't care about my anonymity because I believe it helps, and that's what happens when you come out and you talk to people. I work with my brother who's a psychiatrist to talk to some of his patients that have addiction problems. They're allowed to come to me, they can come to me and talk to me about anything they want. My story, like Chris Heroin, who I know, impacts younger people a lot. What I'm trying to do, and this is a great opportunity in front of you, is to see how I can get out there more and talk to. We do have 12-step programs, which are our young people's groups for continuing. But I've seen so many people die. Refer a lot of people and work closely with St. Christopher's Inn up in Braemore, which is a phenomenal facility. I've been there myself. It's about loving yourself. It's about getting the problem. I had great parents. There's nothing that I can say other than I didn't feel normal. And I was numbing out of something, maybe putting too much pressure on myself. And I caught that later on. And, I'm proud to say I'm doing better than I ever have, and it gives me a right to help people. So it is a real thing. Is there an exact prevention that you can take? This war is too big. But the education and getting to the bottom of what is happening inside with that person is the only thing it was for me. I saw my mother struggle. I see kids die all the time. It's heartbreaking.
Thank you. Thank you for that. I'm gonna ask the panel a question and sort of take us, I guess, back to a central point of tonight's discussion. As a parent who wants to discuss this issue with their child, and they suspect that the child may be abusing drugs, what recommendation would you have for that parent when they're having that conversation? Because we all know what the pushback is, what that relationship, what happens in the course of that discussion. How would you counsel a parent in approaching a child on an issue like this? And certainly, Doctor, we'll start with you.
I need the mic, otherwise he's going to yell at me. Or at least walk towards me. The number, to get a step before that, the number one reason that parents don't have conversations with their kids about substances is that they are petrified that their kid is going to say to them, didn't you do it? Particularly baby boomers, and no parent wants to be called a hypocrite. And so our first task is to get parents over that and kind of role play a little bit about what that looks like. And the short answer to what that looks like is be open, be honest, don't be graphic. So if you had a bong the size of a VW, that's not the time to tell that story. But I think it's okay to say, I experimented back in the day, nothing good came of it, and let me explain to you why you needn't go down that road. And it's akin to, I kind of told you, you didn't have to put your hand on the stove, you didn't have to find it out yourself. And so having that conversation relieves parents from that stressor of saying, I don't want to talk about it because I'm afraid that it's going to kind of come back on me. For kids who we believe are involved, parents always dread, quote unquote, the conversation. There's a very good chance that it's not going to go well the first time out. I would say to parents, plan for that. And they'll say, suppose it doesn't go well. And I'll say, have you ever had a conversation with your teen that didn't go well? Everyone lived, nobody died as a result, everything was okay. And so once you get into, okay, so look, here's what's at stake, here's what we know about addiction. We know that without intervention, it doesn't get better on its own. We know that it's a progressive disease, and the parents who say, this is just a phase, I hope he grows out of it, frequently live to regret that and miss some opportunities along the way. I think parents need to be very clear, very straightforward, very honest, very forthright. The senator has kind of talked about how kids carry a lot of the weight when it comes to these decisions, but I think as parents, the more we can convey these messages in very clear, loving, right? So we kind of heard all that stuff, and you got to be tough on your kid, that kind of thing. Tough is not the same as firm. And you want to keep the lines of communication open. I will tell you that every time I do a parent education forum, some parent raises their hands and says, what about my kid's right to privacy? That is pure lunacy. Right? And that's exactly the way I'm supposed to be non-judgmental and all that kind of stuff. I tell them, that is craziness. You need to stop that. Your kid has no right to privacy, and quite frankly, there's a lot of kids who are dead with their privacy intact. And so I will say to parents, when your kid's life is at stake, you would do anything and everything to save their lives. Do it. Right? If that means looking at their cell phone, do it. If that means dragging them someplace to LICAD or COPAY, then by all means do it. So for many parents, this is not a one-time conversation. Expect that your kid is going to deny it and say, you're crazy, I'm not doing anything. But what happens to parents is your frame of reference shifts so that, and this has happened to me twice in the past 3 months, where parents will actually physically bring heroin into my office and say, I found this in his room. Do you think we have a problem? Right? It sounds insane, right? But this is the way this thing works, right? And they will then say, well, I did the conversation exactly like you said, and I looked him in the eye, and we had a conversation, and he said that he was holding it for a friend. And, you know, I kind of believe him. Right? And being outside the situation, we can laugh and say that sounds crazy. Being inside the situation, as parents, we sometimes take on the characteristics of our addicted kids. And so finding a way to do a reality check with somebody on the outside to understand that 90% of what your kid is telling you is probably not true. Finding a way to bounce it off a friend who then laughs at you and says, have you lost your damn mind, is really important, and to be persistent. So those are some quick tips I'll pass it on.
I appreciate that. Go to the end of the table. Kathy, would you like to add to that?
You know, the years, the tween years, the teen years, they're such a funny kind of a bunch of years because the kids, they're trying to get to be independent. Parents are kind of sitting there wondering, you know, about it. You know, I think our job is to still connect with our teens, still love them, and always let them know that we love them regardless of whether they're using or experimenting. I think it's very important that parents monitor their children, observe what they're doing, so that it's, again, not a surprise. Waiting till a kid is 13 to have a conversation like Jeff is talking about is kind of missing the boat. We need to have conversations every day with our kids. Just open up the newspaper, watch a television show. The drugs, the alcohol, everything's there. There's always teachable moments. We need to guide our kids, set limits. Most important, be a role model for our children. And one of the panelists did talk about family members and exposure to drugs and alcohol within the family. These are all things that kind of just come along with us, come along with our family. And I think, you know, again, loving our children, connecting with them, most important, to helping to facilitate that communication about the issues that come up during the teen years.
Anyone else?
Sure, I'll get in. I think as parents, I think parents are very afraid. They're afraid of the questions they're asking, and they're afraid of the answers that they're going to get. And I think that as parents, they need to be educated. Parents need to be educated, and then they need to parent. I think that parents are very conflicted nowadays. You're talking parents of 10-year-olds are probably in their early 30s or late 30s. You know, they're not too far removed from high school, from the college years. So they're going through their own emotional drama. They're going through their own lives. And now they have an 8-year-old, 10-year-old, 12-year-old, and a teenager. And they're also competing. And I think there is a lot of stress put on parents nowadays to keep up, to keep their children like other children on the block or in their classes. It's very hard for the parents. And you don't want to be that parent that doesn't allow your child to go to that house or be the strictest parent on the block. But we tell them all the time, and in all the programs, I know Pam's seen it in the schools, you need to be a parent first. You're not their friend. You need to be their parent, you need to love them, and I think conversation is foremost in everything. So for the high school parents that will talk about, I'm up when my child comes home, I don't just know that they come home and go up to their room. The parents that talk about conversations, they'll say, I talk to my child when they come in. I want to know what they did. When I talk to them, I can know if there's alcohol on their breath, and I'll know that they're able to have a conversation, not just that they got home safe and went up to their rooms. In middle school, we find out that often the first time a student will have alcohol is at a bar mitzvah or bas mitzvah. And if you think about it at the party, and if you think about it, what happens at these places, half empty glasses left on a table while people are eating or dancing, and how big are the tablecloths all the way to the floor. So the kids will go underneath the tables, and we had a panel of health teachers. They told the middle school, we had a panel of elementary, middle school, and high school for parents, and we had the health teachers from the middle school, and they would say that's the first time that your children will tell us they've had a drink at these parties or these big events. And so that's something where, as parents, if you know that, you can look at that at an event like this. You can go to another place where there's a big event and say, this is where it's happening. Now I see it. You can talk to other parents, and there's strength that way. But I think to answer that question, you need to talk to your children. You need to come from a position of education, and then talk to them more and more, not down to them, but with them, and let them know that as a parent and you're supportive. That is the most important thing.
I just want to add something really fast. In the police department, whenever we if we're going after somebody, we have plans intact. And just like with any kind of profession, you have some type of goal, some type of strategy, some type of plan, because it keeps you on target, right? It keeps you focused, keeps you knowledgeable. I say, if you have a thought that your child is using any kind of substance, where it's in your gut, because I went through a police academy, but I have to tell you, the first scene I went to, it was my gut. I knew what was right and wrong. I say the parent needs to call a LICAD, have a LICAD. You need that strength so that that person doesn't talk you out of your strength. Because it's very easily manipulated, and you're easily manipulated. We love our children. We need people behind us to hold us up and say, wait a minute, I'm not falling back. I'm going to stay on target. Okay, all right, let me call Jeff again. All right, he is, I feel it. Because what you feel in your side and in your gut is always correct. And I tell that to fourth graders, follow your gut. The Too Good for Drugs program is a curriculum. I don't teach it. I do awareness where I'm talking to parents on a different level of what I've seen even in criminality. And I learn so much by sharing the presentation with clinicians. And I'm telling you, work with these people. These people will steer you correctly.
I
just
agree.
want to, oops,
Sorry.
Go ahead.
I agree wholeheartedly that communication is everything, but there's a difference between where were you, what were you doing, what's on your breath, and hey, did you have fun? Tell me about your night. And as much as, yes, you're the parent, you're the authoritarian, you are, if you want there to be open communication, you are also their friend. And I mean, in my house, my brother, the first time he got in trouble, my dad came into my room and was like, let me see who you're instant messaging. And I was like, no, because I was instant messaging my boyfriend. I was 13, and I didn't want him to read it because it was embarrassing. And I was grounded. He automatically assumed I was doing what my brother was doing. And it really closed the lines of communication because now I'm afraid, and I don't want to get in trouble. And if I experiment, if I do this, if I do that, I don't want to tell him. Granted, I didn't have the problem. My brother did, but it wasn't very different. I think it's really important to have open lines of communication because, yes, kids are experimenting at bar mitzvahs, but it doesn't matter if you have your first sip of wine when you're 3, you're 12, you're 25. If you're going to get addicted, you're going to get addicted.
We have a service at my agency, which is located in Great Neck, and it's $250. It includes a mini assessment. A parent has to come with an adolescent. because parents will call and say, I think my child might be using substances, and so we invite them to come and have a mini assessment. It also includes a urine evaluation, but then they have to come for a full session after the results of the evaluation are in. They have to come whether the results are negative or whether they're positive. Because if it's positive, then we're talking about long-term treatment. If it's negative, we may also be talking about treatment, because treatment may mean communication, it may mean what's been going on that your parent may think this. We may want them to come back for another urine test a week later or 2 weeks later, because kids are very good at beating those things. But it helps parents in the sense that you're sitting with a professional, and the professional meets with the child and assesses from their point of view what might be going on, and then works with the parents. The session when the parents return with the child will also include a recommendation. So if the test is positive, the recommendation might be a full assessment, which is 1 or 2 visits, similar to what you were talking about before. And then at the end of 1 or 2 sessions, it would be a recommendation for either inpatient or intensive outpatient, or even like a rehab program after detox. It depends really on what the particular child and family needs. The one thing about our organization is we're family-oriented, so we require the involvement of the family. So it's not my child has a problem, here he is or here she is. It's we're going to work with you as a team to help your child and to empower you to help your child. It also means that if there are other addictions going on in that child's proximity in the home, like a parent who drinks too much or is abusing, that's also going to be assessed as part of the treatment, because as was mentioned by several of the speakers, you can put a child in rehab or inpatient, but as soon as they're back in the community and in the home, they're going to start doing the same thing again if the environment is still the same. So it's just a process.
Where are you both getting most of your referrals?
We get a lot of our referrals from the school district, from area hospitals, and also from TASC. Yeah.
Pediatric part of the
Absolutely.
hospital, or
Yes.
adolescents,
Both.
or adult, or?
Both. Zucker Hillside, we get referrals from there. We get them through TASC, Treatment Alternative to Street Crime, from the Nassau County Department of Probation or Queens Probation. We've had the federal probation program for young people that have been in prison for an extended period of time and are transitioning back into the community. And we also get referrals from patients from families that we've treated, who then recommend us to others. And also churches, temples. School districts, absolutely.
Doctor.
Thank you. I want to back what Michelle has been saying, because addiction is a disease and it is not predictable who is going to get it. And Philip Seymour Hoffman is an example of someone who was sober for 23 years and had 1 glass of wine, and the rest was history. And that just broke open that monster. So my son is an example of someone who failed a very good intensive outpatient. And the family was very involved. But what was also happening was the urines were not supervised. So I don't know whose urine he had.
You can buy it. You can buy fake urine for $50.
He told me twice.
There's also synthetic parts you can buy.
He told me twice that he had supervised urine because he had cough medicine and there was alcohol in it. I believed him, because he was in this program where he was going 3 times a week. He was seeing a 12-step therapist. We thought that everything was going well, but they're not supervising the urine, and the testing has to be better. I mean, now there are saliva tests, which are actually pretty accurate, which are hard to fake. But my son was walking that line, and the other thing he was doing was planning his drug tests between uses. And he was seeing a Suboxone doctor behind our back.
What kind of thing?
Suboxone. Suboxone is it's kind of like methadone, except it doesn't make you high unless you're not using it at all. But it's part of the antagonist, and it's a way that holds you off before the next use. You know, so there's a lot of holes in all recovery systems, and the mental health part of it, and
it would be, I think it would be helpful, and I would love to see us take another forum, perhaps with a different focus, and explore those holes from firsthand experience, because when we bring that together and we begin addressing this issue holistically, it's important that we have that perspective. It's not something that comes to everyone who hasn't been in it, but those who are in it, it's a shame, but everyone who I've heard has a story. And that story oftentimes involves a way that the system has either failed or not gone far enough to address the need. And so, I suggest perhaps we'll take that opportunity and come back and revisit. I do want to thank the panel for being here this evening, for taking the time to share your thoughts, share your experiences, share your insights. I appreciate it. The one, I think, factor here is we're not done by a long shot. This is a process. We have a lot of work ahead of us. But certainly I think we're all better off knowing not only that these resources exist, but also that you're all working in that same direction. I appreciate that. Thank you. But before we close, and I'm going to take a point of personal privilege, and I'm going to ask Kathy to join me up here. Because, when we do have individuals that have gone far above and beyond when it comes to various issues, I think it's incumbent upon us to recognize them. And we have an individual who's here with us today. She was the founder, president, and executive director of CASA in Manhasset. She had committed, is it 14 years? 15 years to the program. And that's a program that's dedicated to, again, students, parents, and the school bringing resources together that way. Incredibly important. Recognized by the Manhasset School Board back in January, but I was in session. So being in session and being 162 miles away, not that anyone's counting, I wasn't able to be there. So I did want to take the opportunity to recognize Liz and to thank her for her service, for her inspiration. I know it's extraordinarily rewarding, and we've had these conversations in the past, to be part of something like this, but to actually have started something and to see it become what it is today. It really is. God bless you. Thank you. And I would ask if you would please join me, because I have a resolution that we passed on the floor of the Senate, and I wanted to present it to you personally. And no one would have believed that she's been involved for 15 years, right? Right out of high school. Ladies and gentlemen, thank you. Thank you very much for being here. Stay tuned. There's more to come. As the task force goes around the state, you will be hearing more and more about it. If you want to see the forum that we referred to earlier, it's on the New York State Senate website. I encourage you to go. See the one that took place in Suffolk County today. Watch them as they go forward. This forum will be available on our website, and certainly you can go back and reference it anytime you want. We will hold further forums as we go forward. Again, to the panelists, thank you very much. Godspeed. Thank you.